How to do an intramuscular glute injection for TRT. What's up guys, my name is Kmart. I've been on TRT for 5 years and I'm gonna show you guys exactly how to do a glute injection for testosterone replacement therapy. I'm gonna bring you guys in a little bit closer and show you my supplies. So first off, we have our testosterone cypionate. They put this in a pill bottle for packaging. We're gonna go ahead and crack that open and show you guys the vial. Now you see this little green thing here on the side? This is what is typically stuck on the top of the vial. All you have to do is just pry this off with your fingernail and that gives you access to the rubber seal here. This is a 200 milligram per milliliter vial, and that is what we prescribe at my clinic, Harley Meds. Then we have our 1cc syringe. We have a 20 gauge 1-inch needle to draw the testosterone out of the vial. Then we have a 25 gauge 5/8 inch needle to inject with. And of course, we have our alcohol prep pad. Now, the area we're working with has already been fully sanitized with an alcohol swab. If you guys are working in your bathroom or your kitchen, whatever it is, just take one of these and wipe down the area real quick, get it ready for injection. Just make sure you have nothing, no contaminants on the table. So we're gonna go ahead and pop open our 1 milliliter or cc syringe and set this down. We're gonna grab our drawing needle out of the plastic and set that down. Now the way that these work is they actually screw into each other. So all you have to do is take the needle and screw it into the syringe. Then it has a removable cap like this. Now just be careful when you put the cap back on, you go sideways and feed it back in and snap it back on. So the first step to get ready for the injection is to pull back an equal amount of air of what your dosage is. So personally, I'm on 0.45 twice a week. It is Tuesday, so I'm gonna do my Tuesday injection here. I'm pulling back 0.45 on the syringe and filling that with air. Now we're going to equal the pressure inside of the vial because the vial is sealed and pressurized. If you were to not pull back air on this, it might be a little bit difficult to draw the testosterone out because it's gonna have a suction effect. So the reason that you inject the air in first is to balance the pressures inside of the vial. So we're gonna go ahead and do that now. Put the needle into the vial. I go directly into the center. Then we're gonna plunge all of this air directly into the vial. Once that's done, now you're good to draw your testosterone out. Now sometimes it can, yeah, see there it is. So it's coming. I'm gonna bring this in a little bit closer so you guys can see. So as you can see, the testosterone is coming into the syringe there, just slowly. It's oil-based, so it's a little bit thicker. Now I always pull back my dosage beyond what I'm prescribed and then I move it up to the area so you can see all the bubbles getting pushed out and then bring it right up to my dosage, 0.45 on the syringe. Then we'll go ahead and pull that out, set the vial down. Now here's the important part when we're switching our needles. So you're gonna pull back all of the testosterone to the back of the barrel. I like to flick it so we get all the stuff out of the drawing needle. Then we're gonna go ahead and cap this back on and screw off the drawing needle and set the drawing needle off to the side and open up. You can set that down, it's not gonna go anywhere. You can open up the injection needle and go ahead and screw that on. And then this is the most important part, guys. When I first got started on TRT, I was really confused about how to get the bubbles out of this. So like I said, pull your testosterone all the way to the back, give it a couple of flicks. This is gonna cause these bubbles to go up to the top and then just slowly move the testosterone up until you get one drop out of the needle. There we go. And watch the needle. There we go. One drop coming out of the needle. Now, we're ready to prep the injection site. Before we go through with the injection, I'm gonna show you guys the exact spot on your glute that you're gonna be targeting. So the easiest way to do this is to split your glute into 4 quadrants, 1 vertical quadrant and 1 horizontal quadrant. You guys can see I had circled my area for the upper outer glute. It's also called ventral glute. This is the target area that we're going for our injection. So now that we know where we're gonna be injecting, I have some key critical tips for you guys for your pre-injection routine. There's 3 things you absolutely have to do before doing your injection. Number 1 is to warm up the syringe, either with warm water or a hair dryer to bring the testosterone to body temperature. This is gonna help your body absorb the testosterone a lot easier and prevent that post-injection pain. Tip number 2 is to inject very slowly. You'll see it takes me quite a few seconds to do my injection. And the third thing is to take a steaming hot shower directly after your injection and massage that injection site just to make the oil absorb a little bit easier. So we already warmed up our testosterone in the syringe and we're ready to do the injection. I'll bring you guys in a little bit closer so you can see the injection happening. All right, so we're about ready to do the injection. We're gonna take our alcohol prep pad and just clean the injection site. Wait for that to dry. I already warmed up the testosterone inside of the syringe, so it is at body temperature right now. So we're gonna try to do this quickly so it doesn't cool down too much. Go ahead and pop the cap off of the needle. Now this, like I said before, is a 5/8 inch 25 gauge needle, works perfect. Now you're gonna wanna pinch the injection site. And this causes the brain to be distracted from the poke of the needle because you're mainly focusing on your thumb and your index fingers. We're gonna go ahead and poke in. Nice and slow. Now you can let go. Now this part is aspiration. So pull back on the needle, make sure no blood goes in. We're clear. And then slowly do the injection. Now I like to stabilize it with my other fingers here as well. Usually it takes me about 45 seconds to a minute to complete the injection. Just breathe nice and normal. You guys can see it's moving very slowly. And we get a little more. Now I leave the needle in for about 5 to 10 seconds just to let the oil fully get in the system. And it is normal for 1 or 2 drops of blood to come out. But as you guys can see, there's barely anything. And then what I like to do is I take my thumb, just massage the area a little bit. Then I go hop in a steaming hot shower, use some shampoo or conditioner, massage that area, and you're good to go. So there it is, guys. That is an intramuscular injection into the glute for TRT. As you can see, it's not that big of a deal. It's a pretty simple thing to do. But I know when I first got started on TRT, I was dreading my first shot. I was worried about pain. I was worried about post-injection pain. But really, all you feel is just a tiny little prick of the needle, and that's about it. I would put it as equivalent to 1/10 of what it feels like to get your vein punctured for taking blood. 1/10 of that. It's barely a poke, and I seriously mean that. And I hate needles. I've always hated needles even since I was a kid. So that's pretty much it. As you guys saw, it's a very easy process to do that intramuscular injection. Now, if you want to get started on TRT through my clinic, Harley Meds, check out our website, harleymeds.com, and we can get you started ASAP. See you in the next video.